Hello, my name is Ella Mayer. I am originally from Simi Valley, California. I am a rising sophomore at UC Berkeley studying public health. And let me tell you, this summer I had the absolute privilege of interning at Kaiser Permanente in Woodland Hills at the Results Management Office through Health Career Connection. Ever since I was younger, I've always put myself in this mindset of what can I do today to help make a difference in someone else's life tomorrow. So naturally, I pursued an internship with HCC with this thing in mind. I didn't just want that glimpse of clinical work. I wanted to truly understand how our healthcare system works as a whole and how do the behind the scenes operations work to enhance a patient's stay in the hospital, or how can we generally help our patients at a greater level. This past summer, I worked on projects across a variety of departments: pharmacy, bioethics, supply chain, HR, and a few others with the Healthy Workforce Committee and Care Experience. With the pharmacy, I chart reviewed nearly 200 patients on a diabetes medication, messaged their doctors to recommend starting them on a statin medication, and called patients about their medication adherence. For my next project with the bioethics director, I coordinated meetings to support unrepresented patients, revised data tracking tools, and I even got to draft the very first version of the hospital's 1799 policy for psychiatric holds that are involuntary and that help impact inpatient care. In supply chain, I built data visualizations to track surgical supplies and reduce waste, and I even got the chance to shadow a tram flap procedure as well as, get this, an awake brain surgery. In HR, I digitized employee records to support compliance with hospital regulations, and I learned a lot about CMS surveying. Outside of my core projects, I designed graphics for Care Experience, as well as a wellness newsletter that reached over 4,000 employees in the medical center. I even got the chance with my team to help provide fresh produce to families experiencing food insecurity in the Valley. Now, if you asked me at the start of the summer what I picture my future to be, I would have given you a very clear-cut answer: becoming a physician. But over the past few weeks, I've really got to understand that healthcare is this huge interconnected web of people, policies, and decisions that all shape a patient's lives in different ways. So whether I'm in a white coat listening to a patient, in a conference room analyzing data that helps improve hospital operations, or sitting at a board meeting at bioethics grappling with how to treat a patient who is deemed unable to make their own medical decisions, I want to be that person who designs and even works to fix our healthcare system to truly serve the patients and communities that need it most. Lastly, I truly believe that it is the people who make experiences so meaningful, so I'd like to give a huge thank you to my mentor, Sophia Porter Castro, who's made this experience beyond anything I could have ever asked for, and the RMO team, Christina, Yvonne, Patty, Harold, and Vanessa, Kaiser Permanente Woodland Hills, Roy, Jeanette, Beatrice, Mike, Erica, Bernadette, and so many more people. And of course, Health Career Connection for trusting me, challenging me, and opening doors I never knew existed. It really goes to show that the true power of healthcare lies in not just treating individuals, but in building systems that support communities as a whole. And that's the journey that I'm excited to keep pursuing.